presentation. So basically, this was a multi-center study that involved 5 different centers using the PFC Sigma fixed bearing knee system. And the study was a prospective study, started in 2005 and went on till 2017. And basically, we were looking at a different polyethylene in the knee replacement, irradiated cross-linked polyethylene, and was used on the PFC Sigma cobalt chrome tray. It was fixed bearing, not mobile bearing. So there were 5 sites involved, and in total, we collected data on 537 patients. And we looked at the demographics, we looked at clinical scores preoperatively, and we then followed them up 3 months, 1 year, 3 years, 5 years, and 10 years. So the average follow-up was 8.47 years. And the longest follow-up for this study was 11.2 years. We also did radiographs at each visit looking for radio loosening, and we monitored very closely any complications and recorded them whether it was related to the device or not. So when we looked at the results, slightly more females than males. The average age was 66 and the average BMI was 30. And the majority, as you would expect, were osteoarthritic, 96%, a few rheumatoids, a few post-traumatic arthritis. And the studies involved, most of the patients were cruciate retaining prosthesis. So 97% and only 2.8 were posterior stabilized. With these kind of studies, any complication is thoroughly investigated, and there were about 1.7% that we thought were due to the device and not due to any other complications such as anesthetic or non-prosthesis related. When we looked at the radiographs, so these were monitored very closely, particularly the AP tibia view, looking for progressive radiolucent lines of more than 2 millimeters. And at 1 year, there was 4.4% had a progressive radiolucent line. But by 10 years, this had decreased down to only 2%. On the lateral view, this is mainly at the femoral lucent lines and part of the tibia. It never exceeded 2% throughout the whole study. So there's slightly more on the AP view is where you see most of the lucencies in knee replacements is on the AP view under the tibia. So when we looked at the revisions, it's very similar to most studies. The most common cause for revision was wound problems, either with or without infection. So 6 of the 500 odd. There were 5 aseptic loosenings of that. 3 were done for pain, 2 were done for stiffness, 2 were done for periprosthetic fractures. Another one was for trauma with the joint capsule rupture. Interestingly, only 1 patella was replaced. Usually it's a lot higher than this. Most of these cases didn't have a primary patella replacement. And there was only 1 revision for polywear. But after the 10-year study was complete, there was another study, another patient that 10.3 years was noted to have polywear. When we looked at the American Knee Society score and the American Knee Function score, so first of all, the American Knee Society score, which is based mainly on pain and range of movement, and it went up from 38 out of 100 pre-op to 87.5 at 5 years and 88 at 10 years. And if you subtract the pre-op from the 5 and 10 year data, you can see there was an improvement of 47 and 48 points respectively. So patients were happy from a pain and movement point of view. From the function, the American Knee Society function scores based on how far people can walk, where they can go up and down stairs, and pre-operative was 54 out of 100, and it went up to 70 at 5 years, and slightly less at 10 years, 65, but still overall a good improvement. We also did the Oxford score, the SF-12 physical and mental, and you could see from pre-op at 5 years to 5 years and 10 years, it went up. So the Oxford score from 20 went up to 36. The SF-12 went from 27 to 40 for the physical side, and the mental side, it didn't really change. So as often happens with knee replacements. So looking at finally at the overall survival rate, at 1 year, there's 99.4% survived of 537, and this slowly decreased, but still at 10 years, there was a 95.4% of knees were still in place, which is about average for this type of fixed bearing knee replacement, or if not better than most knee replacements. So it's a very high, you can tell patients are going to have a 95% chance of the prosthesis still working well at 10 years. And this is the Kaplan-Meier curve that's with time, there's just a slow but steady recurrence of revision rate. So the conclusion is the PFC sigma, with the highly polished stem, which stops backside wear, gives an excellent 10-year survival with a moderate cross-linked polyethylene. And this was a study up to 10 years. And the final take-home message is a 95.4% 10-year survival of this prosthesis with this cross-linked polyethylene.